You're taking 8. Minister, please proceed.
Thank you very much, Gael, and I do agree with one point Deputy Byrne makes in terms of the importance of the centre holding. There are many people on the extremes of Irish politics who wouldn't have thought we'd ever get to this point as an Oireachtas, where we can deliver a budget, and quite frankly didn't do anything to contribute to that process. I'm very pleased to have the opportunity to address the House on Budget 2017 and specifically on the 2017 health estimates. This is my first year as Minister for Health to address this House in this important matter. And I am particularly pleased to be in a position to talk about a budget that will place the health service on a more sustainable financial footing and will allow the health service executive to set realistic and achievable targets for service areas in the year ahead. I believe the message of the people at the last election was very clear. They wanted to see the gains of a now recovering economy invested in the services that our people depend on. And I do believe that this budget demonstrates that government has listened to that message. This year, 2016, is the first in very many years that the health service will come in on budget. This is a direct result of the government providing an additional €500 million of funding to the health vote last July to improve the base funding of health and to break that awful cycle of supplementary estimates that had developed year on year. The improving economy has enabled the health service to achieve much needed budget increases in each of the last 2 years. And now, by coming in on budget this year, the key thing is that the funding that we've received in the budget this year can be used for services, service development, rather than to fill a black hole or an overrun. I think that's important. The additional funding provided during the course of 2016 gave me, as Minister for Health, the opportunity to address some immediate issues facing colleagues, such as investment in a winter initiative to manage overcrowding in emergency departments, in addition to meeting important commitments in the programme for partnership government, which my ministerial colleagues will outline later. I am pleased to announce that once again the government is asking the Oireachtas to allocate additional exchequer funding for the health sector for 2017. The gross current budget for the health sector for 2017 is €14.152 billion. This is equivalent to an increase of €457 million compared to the 2016 allocation of €13.695 billion voted through the year. The provision for 2017 represents a 7.4% increase on the original voted budget for 2016 and a 3.5% increase on the final projected 2016 outturn. The health vote for 2017 has increased by 9.4% over the 2015 outturn position, recognising this new government's commitment to providing a health service that seeks to improve the health and the well-being of the people of Ireland. The additional funding secured will continue to ease the pressure on the health service to provide the optimum level of safe services for patients within the budgetary limits. However, let me be clear, there are still real fiscal challenges facing the health service. Healthcare demands continue to rise due to our growing and our ageing population, the increasing incidence of chronic condition and advances in medical technologies and treatments. Accordingly, we must continue to focus on effective financial management, on cost containment and on cost avoidance. I am pleased to confirm that there will be no increase to prescription charges, the monthly DPS threshold or income thresholds for eligibility for medical or GP visit cards in the coming year. Funding for the Fair Deal will be maintained at an appropriate level to meet demand and will crucially keep waiting times at a maximum of 4 weeks. I believe this shows the government's continuing commitment to stabilising the direct cost of health services for citizens. I am grateful to my colleagues, Ministers Noonan and Donoghue, for their support and understanding in dealing with the challenges faced by the health sector. The level of health services to be provided within the available funding will be set out in the HSE's 2017 National Service Plan, which is currently being prepared by them. However, I will outline some of the issues which will be more extensively covered in the Service Plan. My colleagues, Minister McGrath, Minister McEntee, Minister Corkin-Kennedy and Minister Byrne, will be setting out information in relation to their own areas of responsibility, so I will not do so now. Under this budget, €15 million additional will be allocated to the National Treatment Purchase Fund to deliver a waiting list initiative in 2017, specifically directed towards providing treatment for our longest waiting patients. It's vital it targets people waiting the longest. This brings the funding available to the NTPF to €20 million for 2017, rising to a further €50 million in 2018. So we have €70 million for ring-fenced waiting list initiatives in 2017 and 2018. This is our commitment to improving waiting times for patients. In August of this year, the HSE developed a waiting list action plan focused on reducing the numbers of longest waiting patients. Throughout 2017, my department will continue to work with the HSE on reducing waiting times through driving efficiencies and process improvements, with a particular focus on adherence to chronological scheduling and validating waiting lists. Just because the NTPF is up and running now cannot be an excuse for the rest of our system not to continue to absolutely do everything they possibly can to improve waiting times alongside the work being undertaken by the NTPF. I am also delighted that the €40 million allocated as part of the additional £500 million voted in July has been provided on a recurring basis for the winter initiative. This is important. The winter happens every year. It is important we keep the funding in the base. This funding is crucial in enabling winter preparedness measures across our health service and in reducing overcrowding pressures in our hospitals. This coming winter, the initiative will deliver an additional 950 home care packages, an additional 58 transitional care bed approvals every week, an additional 55 acute beds and 18 additional step-down beds, as well, importantly, as expansion of community intervention teams across 4 areas of the country and expansion of minor injury services in the Dublin area. May I say that the winter initiative and indeed the pressure on our hospitals cannot be resolved by just looking at the acute hospital. We've got to drive down delayed discharges. If you want to provide more beds in our hospital, yes, there's a need for a bed capacity review and probably a need for much more investment in our beds, but we have beds in our health service today that are being occupied by people who don't wish to be in them and don't medically need to be there. That's why the winter initiative and the budget is focusing on home care packages, transitional care beds, step-down beds, community intervention teams. That's why we want to see a new GP contract also. I very much welcome the additional funding for our acute and our emergency services in this budget, which represents an increase of over €90 million on the revised allocation in 2016. The increased allocations in 2017 for our acute hospitals, for our National Ambulance Service and for the National Cancer Control Programme demonstrate my commitment and our commitment to driving key policy and strategic initiatives to improve and expand acute care and emergency services for patients. This funding will enable continued progress to be made on initiatives such as finally delivering a new children's hospital, progressing and implementing Ireland's first ever national maternity strategy and the winter initiative, as well as driving improvements and expansion in the areas of cancer care for patients, in terms of our ambulance services, and we have much to do on that front, in terms of waiting lists and paediatric services, to name but a few. We will also provide funding for 1,000 new nurses to join our health service, and I was pleased to be able to make an improvement to their pay of nurses who graduated between 2011 and 2015 today, with the announcement that their increment will be restored from January. In 2017, in line with the commitment in the programme for partnership government, we will increase our investment in ambulance services. The capacity report identifies significant deficits in our ambulance services, which we will need to address incrementally over the next few years. Additional funding this year has allowed us to start that process, and the provision of further additional funds for 2017 will facilitate the development of the intermediate care service. That service focuses on providing transport for low acuity patients, including inter-hospital patient transfers. By investing in the intermediate care service, we aim to free up the emergency fleet for the emergency calls, thus improving the service overall. I want to also say, in terms of primary care, we are going to get on and deliver the medical card for all children in receipt of domiciliary care allowance, continue our commitment to primary care and get on with delivering the new GP contracts that are so badly needed. My colleagues will outline other measures.